Hi, this is Dr. Chen. I'm here with Julie. We're going to do a little, do some microneedling treatments with some PRP to help improve the skin tone. And we've already cleansed her face. We put the numbing cream, and we've harvested the PRP right here. And so we're going to get started. And then as soon as we're done microneedling, we're going to add the PRP. These channels stay open for about 15 minutes. The way I do the microneedling, there's two components, how deep it goes and how fast it goes. And a large part of it is how well this glides across your face. There's a lot of people who say you should just press like this, which is effective. Or what I've been doing is I'll get this nice and slick with the glide, which in this case is the Platelet Poor Plasma, and we're just going across her face to where we'll just get a little punctate. You'll get some skin reaction, some punctate bleeding. Your depth is going to be determined by how much the patient can tolerate. Julie's doing really good right here. We're not getting any drag of the blade. If you feel like the needles are dragging, then you can't do it this way. And then you just go back to the advancement technique like this, which I will use when I get to some deeper areas. Julie has a small little scar, which we were gonna hit from, she had a mole taken off a few years ago. And so she's getting a little 2-for-1, a little skin rejuvenation, as well as some flattening of a mole that she had removed. All right, so we're just finishing up the microneedling right now. I'm just doing light passes all the way around, because the next thing that we're gonna do is just application of the PRP to help to bring in the growth factors that the activated platelets will bring in. And due to the topical anesthesia, Julie is taking this exceedingly well. We've been able to play with depths, usually 1.5 to 2 millimeters. And I'm going a little thinner right now in her forehead. But we're going to make sure that everything is good and ready. It's amazing when you're doing the microneedling, you will see the skin literally just dry out in front of you, because it's like it's just ready to just suck up whatever you put on the surface, whether it be growth factors that you can buy, or in this case we're using Julie's own blood and making some PRP. So like I said, last little pass, make sure everything's nice and open, make sure all areas have been covered. It's pretty easy to see. Basically go for the areas, get them a nice even red as we've gotten them. Here's the PRP that we have spun down. And now I'm just gonna turn to the side, and we're just gonna gently put it over across the top. Now at this point, we can do a little injection as well. We can do little injections to certain areas if we want. It's very well tolerated. But the great thing about this is there's been no manipulation done. This is all her own. This is her own platelets and plasma. So we have not added anything to it. And it's gonna come in here and help get a nice clear complexion for her. Help treat some pore size. Not that her pore size is bad, but it'll just make everything nice and smooth. And we'll have a couple rounds of applications, because literally in a few minutes, this area that looks nice and wet right now from the application will literally be very dry, because the microchannels are just going to allow this to penetrate past the stratum corneum into the mid levels of the dermis, where all the good stuff, mid and deep layers of the dermis, where I've created the channels. All right.